I am Justin Phillips, and I'm the founder and executive director of Overdose Lifeline. Stigma is an important topic for me and part of our platform at Overdose Lifeline because I think it completely interferes with a person's ability to seek help and the family's ability to seek help for their loved one. I believe that the denial comes directly from the stigma that we perceive in society. So when I think about Aaron, my son, who overdosed on heroin in October of 2013, and his first asking for help and his first admittance to me that he was using heroin and could not stop on his own, I didn't take off work. I didn't share with my fellow employees that my child had a disease that could kill him. We don't treat the chronic disease of addiction the way we treat other chronic diseases. So I knew that if I went to work and shared with my coworkers, which is part of our family, I mean, we spend a lot of our life with people that we work with, that Aaron was using heroin, there would be shock, dismay, judgment. I wasn't going to do it. I let someone else take Aaron to treatment rather than me going myself. If he had had cancer, of course I would have gone with him to the doctor, to the hospital. This is how we treat the disease because it's a stigma that we believe it's never going to happen to us, that something must be fundamentally wrong with you if you have this disease, that you, yourself, your character, your person, have done something to bring this upon yourself, that you are flawed. As humans, we judge each other. We don't see it as a disease. We never see it as a disease. If we treat it like a disease, I can come to you and share. My son, has found himself addicted to heroin. I got to go get him the best treatment I can find. That's what I would do for another disease. We rally around a family if they lose a loved one or they have a loved one sick with a chronic disease, and we never take casseroles to families with substance use disorder. We don't treat those families in the same way we treat families with other chronic diseases. I'm sure if we looked at emergency medical services, we would see that we have used resources on individuals more than once who have heart conditions and suffer heart attacks. We would never say to that person, sorry, you had 2 heart attacks already. We're not going to give you the 3rd revival. We're not going to do a 3rd bypass surgery on you. Resources or not, because you've had your chance and you haven't changed your diet. This is not a criticism of people who suffer with improper eating habits, because we all, as humans, have challenges around discipline with health and wellness. We're all suffering, right? So when are we going to be willing to stop judging people for their suffering and understand with compassion? The way substance use as a disease reacts in our body physically is a hijacking of the brain system, and the behavior that manifests is illogical, which I believe plays into the stigma and our inability to accept it the way we accept the behavior of someone who suffers, say, unhealthy eating habits and continues having heart disease. Their behavior is less harmful to others than the behavior of someone suffering from substance use disorder. Addiction is a physical reaction to the substance ingested in our body and not a moral failing or a character flaw. From almost immediately, that stigma and denial played a role in Aaron's death. And I don't say that to make myself guilty or to place blame on myself. I just know, had he been suffering from another disease diagnosis, I would have been louder and I would have sought help in a different way. Stigma is almost an intangible, invisible barrier that we don't understand, but that completely interferes with the individual who suffers in getting the help they need, with the family who loves someone and them asking for the help they need, for the understanding in the community of the needs of the individuals, and for preventing in the first place. Stigma has to be addressed. We have to be willing to talk about what's happening in our families around substance use disorder so we can adequately get the help that we need. Cancer has been something that was talked about in hushed tones. Again, because we misunderstood and we didn't want cancer. So if we talk about it, it makes it more real. The less we talk about something, the more we deny something exists, the less we have to understand and take action. Taking action on something that we don't have a good, solid, guaranteed solution is difficult. We judge a reoccurrence of the disease of addiction completely different than we judge the reoccurrence of another disease. So sometimes, as a type 2 diabetic, I forget to check my blood sugar and I have an issue. My blood sugar spikes. Maybe I potentially have to get some revival. Nobody gets judged for that the way that we judge someone who has a reoccurrence of their substance use disorder. When Aaron died, it was important to me to talk about it. For those reasons, for the shame and stigma, for the reality that shame and stigma and denial played a part. I needed other people to feel like we could talk about it. I needed to tell the story so other people didn't have to feel alone like I did. There are reasons that people misuse substances that don't have anything to do with the substance being addictive, like opioids, right? So we'd like to say it may start with the first choice that was bad. I may have heard from a friend that if I tried this substance, it would make me feel better. And I feel sad, and I don't want to feel sad. I do want to feel better. So I'm willing to try what my friend is suggesting to me. So what are we doing about feeling sad? And rather than talking about drugs are bad, don't do them, maybe we talk about why are we using drugs in the first place? And what are we going to do about that? And that we're all using something. Work, shopping, hair and makeup, our car, our house, food, alcohol, illegal substances. If we normalize it, if we talk about it, maybe we'll stop using substances because we'll be able to have common connection.